Namaste बिटिया हमेशा खुश रहो बिटिया Myself JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JV'n University Jaipur. In today's lecture of Clinical Practice of Medicine, we are going to discuss about the various psychological tests that are needed to be done for the psychiatric assessment. Whenever a patient of psychiatric disease is coming to you, what are the various psychological tests that can be done in patient with psychiatric disease? There are various tests that could be classified in number one, objective test. Objective test includes these are pen and paper test. You are given a pen, you give a pen and paper to the patient and ask various things to be written on the paper. You will ask about the objective test for personality and intelligence of the person to check for the personality and his intelligence. You can check for the objective personality test. For example, of objective personality, like MMPI, that is Minnesota Multiple Personality Inventory, and 16PF, that is 16 personality factors. You can also check for the intelligence test, like some commonly used tests for intelligence are WIS, that is Wechsler Adult Intelligence Scale, Standard Binet Test, and Bhattia's Battery of Intelligence. There are various those projective tests that could be done for the psychiatric assessment. In projective test, there are ambiguous stimuli that are used, which are not clear to the person immediately. Some commonly used projective tests of personality are Rorschach, Inbox test, and TAT. Sorry. There are various neuropsychological tests, which includes some of these are commonly used. Neuropsychological tests are Wish Connolly card, sorting test, Wishel's memory scale, GI memory scale, Digit test, that is Bender Gestalt test. There are various rating scales, like several rating scales that are used in psychiatry to quantify the psychopathological observed. Some of the commonly used scales are BPRS, that is Brief Psychiatric Rating Scale, SAMS, that is Scale for Assessment of Negative Symptoms. The last one is the diagnostic standardized interviews, which includes these are the instrument that makes the diagnostic assessment more standardized. These include PSE, like present state examination, SCAN, that is schedules for clinical assessment, and neuropsychiatry. I will again just review this various tests that I have already discussed. There are some objective tests, which include subjective personality test, intelligence test. There are certain projective tests. The third one is the neuropsychological tests, various rating scales that could be used for rating the patients, and various diagnostic standardized interviews like PSC and SCAN for the clinical assessment of neuropsychiatry. So this was all about the psychiatric assessment, this various psychological tests that could be done in case of psychiatric assessment. But this was all about neurology chapter. In the next lecture, we are going to start with the endocrinological examination. History taking. So this was all for today. This session is powered by Digital Version 2.0, Jyoti VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.